Thank you so much for having us today. I have no relevant conflicts of interest. I'm a practicing fellowship-trained double-board orthopedic surgeon and clinical researcher in musculoskeletal aging, and before that, I served women at the bedside as a cancer nurse, so I've been taking care of women for nearly 30 years. And in these 30 years, I've probably taken care of 100,000 people as a physician. And so looking 100,000 people in the eye gives me a deep sense of what they need in their suffering. And when I'm on call now, I frequently meet women in the ER, such as Miriam. They have broken their hips. This is the rod that I put in Miriam's hip. This is only one of many kinds of metal screws, plates, implants that I use to treat their hips. Because of a condition, osteoporosis, that is largely preventable. There are approximately 80 million women in this country over 40, and up to 40% of them will develop osteoporosis. This is a rate 4 times that seen in men and occurs 10 years earlier than in men. And osteoporosis is not just the slow, steady state decline seen with aging. This, according to the Endocrine Society, is a sharp, precipitous drop in bone quality where we lose 15 to 20% of our bone density in the 5 to 7 years surrounding our perimenopause, the exact time when we're losing our estrogen. 1/2 of women with osteoporosis will sustain an osteoporotic fracture, 1 in 2. So statistically, that means it's either going to be me or it's going to be you. In fact, 70% of all hip fractures occur in women. And for women like Miriam, the minute she breaks her hip, she has a 30% risk of dying in 1 year from the complications of hip fracture, and she has a 50% chance of never returning to pre-fall function. When I met Miriam in the emergency room, she had simply fallen in her kitchen. She was excruciatingly painful when I met her because fractures are painful. When we were working her up for surgery, we found that she had chronic recurrent UTI. She had one when she presented, and she had never been offered vaginal estrogen. And surgery was delayed because her heart was so damaged that she had to be optimized for that, and that is a very common story. Miriam had a 30% chance of dying for conditions that we know: genitourinary syndrome of menopause, musculoskeletal syndrome of menopause. We know they can be prevented with estrogen. Estrogen plays a key role in the remodeling of bone, meaning the balance. There's a constant balance between breakdown and building of bone. And when we do not have estrogen, we break down bone at a much higher rate. According to the NIH consensus statement and the European Foundation for Osteoporosis and Bone Disease, estrogen is the only well-established intervention to reduce the frequency of osteoporosis fracture in postmenopausal women to the tune of 30 to 50%, and the WHI itself found a 33% decline in fracture. In fact, the FDA has approved estrogen for the prevention of postmenopausal osteoporosis, and yet only 4% of women, it is estimated, in this country are currently enjoying its benefits. Estrogen is not just a Band-Aid that we put over the osteoporosis problem when women are very old. In fact, estrogen is critical for the prevention of osteoporosis when women are younger, in their perimenopause, in their early menopause, before we lose 20% of our bone. It's estimated that estrogen must be used 10 years to change the outcome of fracture, and that once you stop estrogen, according to the least dosed, shortest time mantra, within 6 years, your bone will rapidly decline as if you'd never had it at all. From the point of view of this bone surgeon, the data on the benefits of estrogen for prevention and treatment of osteoporosis is undeniable. And I have to admit to you, I am tired of women suffering, and I am tired of having to put big metal objects for a condition that we could have prevented. Thank you so much.